PGY1 resident here at Piedmont Columbus Regional Midtown. We are so sorry that you are not here today for an in-person tour of the hospital. Unfortunately, due to the COVID, we have decided to make this a virtual tour for you today. So we'll show you the place that you'll be working every day. All right, let's go.
Hey everybody, I'm Rebecca Cummings. I'm the PGY1 RPD and Pharmacy Clinical Coordinator.
And what are you working on now?
I'm actually working on resident candidate interviews.
How you doing? So I'm Ryan Crossman. I'm the clinical manager for the system. I've been with Piedmont since 2006. I did my residency here. I went to pharmacy school at Auburn and did my undergrad at UF. So my involvement with the residents is I work with Matt, our ER pharmacist, with regards to their research. I'm here to assist, in any way I can possible. I'm on call 24/7, 365. So, I take calls from the residents in the middle of the night, on weekends, during the day. So I'm here to make your year as successful as possible. Other things that I help residents with. Letters of recommendation. What's important, for me is, you learn as much as you can during this residency year, but where do you go when you leave? And that's what I'm here for. So I'll be one of your biggest advocates when you come on board.
Okay, and what are you working on now?
Currently what I'm working on is COVID, which everybody's working on COVID right now. We have an infusion center next door that's infusing the monoclonal bavdegalutamide. And I'm the infusion pharmacist over there. So I'm spending a good chunk of my day assessing patients for, if they're still candidates for the bavdegalutamide, and if we have to send them to the hospital for the remdesivir or dexamethasone. Also, counseling on what they're receiving and making sure that they understand the drug that they're getting. Some of the patients are scared when they come in, and I'm there to, calm them down and make sure they're comfortable with it. So for the past month, that's been really my primary focus. Starting 2 days ago, we started rolling this out to community nursing homes. So we're making the monoclonal here and delivering it to the nursing homes to be infused there. So we're trying to hit COVID from all angles, from vaccinations to monoclonals, as well as the patients that end up here in the hospital.
Hey, my name is Dr. Tab. I'm the infectious disease pharmacist here at Piedmont Columbus. I've been here for 33 years and I was a bench microbiologist first. So the experience that the residents have whenever they're on service does blend antibiotic stewardship and infectious diseases from a pharmaceutical perspective, but it also incorporates clinical microbiology. So micro is right down the hallway from us, and it's not uncommon for us to get lots of questions from micro and have to assist them in different microbiology issues.
And what are you currently working on?
What I'm currently working on today is COVID, just like everybody else is right now, but unlike some of the other clinical pharmacists here, we're working on the active COVIDs. So we have a pretty big census right now in our third, wave. And I work very closely with the infectious disease physician here. The residents assist and also the students assist. And right now it's kind of all hands on deck. But in addition to COVID, we have to think about antibiotic stewardship and our responsibilities from appropriate utilization of antibiotics. So we're focused on different aspects of stewardship too, including committee responsibilities as well.
So my name is Haitham. I am the PGY2 pharmacy, infectious disease pharmacy resident here. I did my PGY1 in St. Joseph Hospital in Arizona. So my role here, I'm covering the ID service with Dr. Tab, which include working with the vancomycin sheet, the microbiology, and working also with the ID physician here, and including COVID as well.
And what are you doing now?
So currently I'm doing mostly all kind of stuff, but mostly COVID. I'm working on the active COVID because of the high census, and I'm working with the student for doing other ID service like the vancomycin and the microbiology and the antimicrobial in general.
Ready? Hey, my name's Matt. I'm the ED pharmacist here at Piedmont. I've been here 6.5 years in the emergency department. Did my PGY1 training here. Did my PGY2 emergency medicine at University of Florida at Jacksonville. Current role right now between ER is also covering one of the main COVID units. So working with COVID patients in the ER and also up on the floor. So we come in the morning, work through all the patients in the ER, work through all the patients on the COVID floor. We're rounding with the COVID hospitalist team, come back down to the ER and just kind of continuing to post around, work through the rest of the patients as they come through the ER. The primary focus outside of COVID is going to be ER, so we're helping out with patients in cardiac arrest or ischemic strokes come in, traumas, really anybody coming in that's critical. We try to be at the bedside to help with medication procurement, recommendations, getting meds in the patient. Now we're kind of split between ER and COVID, so that just kind of adds additional challenges. Trying to split time between the two places, bounce back and forth. Outside of that, also in charge of research for the residents, so I'll work with you guys on your research projects, kind of help get those designed and implemented. Get everything ready to present at the regional conference. Right now, we just finished rounds here a little bit ago, so going back through all the recommendations from rounds that we got to get implemented, and then we're actually just infused a patient with bamlanivimab in the emergency department, so had to go do counseling for that, talk to the patient, get the nurses on board with how to administer it, kind of working through that process. That process is still new for us, so trying to figure out how we're going to get that accomplished in the emergency department. And then just for the rest of the day, just kind of working through as patients come in. We're responsible for orders for the COVID unit and for the ER, and then just responding to any other urgent needs that come in. So far, we've had cardiac arrest, a patient stopped breathing, and a patient that got stabbed. And it's just now lunchtime. So busy department, lots of patients, lots of acuity. So you guys will be down here for 4 or 5 weeks. I think it's 5 weeks. And you guys will be working right alongside me with seeing the patients, with the providers, having bedside discussions, just kind of working through that. So look forward to meeting you guys.
Welcome to the NICU. I am Laura Hagan. I do set the pediatric rotation here at Columbus Regional. I have been a pharmacist here for 15 years. I love what I do. I have a great relationship with the physicians that I round with and the pediatricians as well. So it's really a multidisciplinary approach here, and you'll really get a feel for that when you get here. We have a 46-bed level 3 NICU, so we're really busy. We have a lot of transports that come in from all around our area, up to Atlanta. So we take care of a lot of sick babies, so it's really fun.
So what are you working on now?
I just got done with pre-rounds, so rounding will begin soon, but I am currently trying to figure out how we are going to deal with a multivitamin shortage for TPNs. So we are out, and we're trying to figure out what's the best way to provide vitamins to our babies in the meantime. So.
Hi, I'm Lauren Duty, and I have been here for quite a while. I guess I'll be telling my age a little bit. I graduated in 1992 from the University of Georgia, and I came down here, and I was fortunate enough to participate in development of the pharmacy practice residency program. So I was the first resident of the program, and then I have had the opportunity to stay here and work in a lot of different areas. I've worked in the primary care setting as well as the inpatient setting. I am currently one of the evening shift clinical pharmacists. I work in a 7-on, 7-off position, and we are responsible for providing the clinical services to all the patients in the hospital during this shift, as well as the order entry responsibilities. And we work with the residents on a regular basis, either with pass off from one shift to the next. Sorry, hold on. Or when they come and spend time with us on the rotation, working with us on the second shift, and then anytime as needed for projects or anytime that they just need to talk with one of the preceptors.
What are you working on now?
We're currently working on some monographs that we're working on. One of the residents is currently working on presenting her monographs, and then of course we're working on order entry. Thank you for your time.
Hey, my name is Katie. I am a second shift clinical pharmacist. I work with one other partner on second shift, and together we, what we like to say, we divide the house, or we each take half of the hospital. It involves covering a variety of different things in different areas, but it is probably one of the best and greatest things about second shift.
And what are you working on now?
Currently, I am working on monographs with our current resident, where we do an entire review of the therapeutic interchange for the Piedmont facility as a whole, where we make decisions deciding on what our formulary will be for the year for the best cost-saving measures, but also what is the guideline saying. I'm also working on reviewing a Grand Round project as well with another resident.
Hi, my name is Tushar Patel, and I am the oncology pharmacist here. So I cover the hematology oncology floor, and this is our 7 main satellite, and this is our office.
What are you working on now?
Just verifying orders for patients and then creating chemo orders.
Hey, so my name's Josh Chestnut. I'm a preceptor here. I'm also the PGY2 Critical Care Residency Director for those who have that interest. and we're housed out of the unit for our critical care services. And my position here is mainly Monday through Friday, 6 to 2:30. We round with multiple physician teams. Right now we have 3 physician teams, for example, with COVID expansion, but that may continue. We're planning on opening a neuro ICU soon, or really reopening, just with the COVID fluctuation. Our days entail both the day-to-day patient care tasks, as well as working on quality improvement projects with nursing and physicians. We're very fortunate to be well integrated with interdisciplinary teams.
And what are you working on now?
And so right now we're working on a number of projects. One of the things we're working on is going to AUC dosing of vancomycin for the facility. We're also working on enhancing safety and improving our medication delivery, more timely medication administration. We are working on just items related to medications that are, neurotherapeutic index. That may be trying to implement glucomandir for insulin drips, or working with our colleagues to implement CRRT, some of these devices and things that will improve patient safety here.
Hi, I'm Jillian Davis, or Jill, you can call me Jill. I'm the current PGY2 critical care pharmacy resident. Right now I'm on my medication safety elective. I'm currently helping cover the ICU today, working on pre-rounding for COVID patients to meet with our COVID intensivist and COVID infectious disease provider. I'm also working on a glycemic control program for COVID patients on continuous tube feeds, and we'll continue that until our day is over.
Hey guys, my name is Aish Patel. I'm one of the internal medicine pharmacists at Piedmont Columbus Regional. A few of my responsibilities here at Piedmont Columbus Regional is that I precept the current students as a part of their ACT programs with Mercer University, help out with the research projects, also help out the students with their student responsibilities. I help cover internal medicine floors, so whether those are the 899 manual med surg floors, help out in ICUs, which is what I'm doing right now today. I help cover central pharmacy along with that as well. Yeah.
And what are you working on now?
So right now I'm helping out in the ICUs. Since it's COVID, there's a lot of critical care patients. So today I'm helping out one of the ICU pharmacists along with our PGY2 critical care resident. And as of right now, we just finished working up all of our patients, and we're just going over the physicians to present our interventions.
Welcome to the 9 Main Satellite. My name is Jordan Baxley and I am a preceptor for internal medicine. I have been here for almost 8 years. I went to Stanford for pharmacy school and moved to Columbus for residency, and I loved it so much that I stayed. I currently cover 3 floors, adult medicine typically, and we have about 75 patients on my census, typically with orthotrauma and cardiology patients. I also cover the progressive care unit, which is kind of a step in between ICU and internal medicine. But right now, most of my patients are COVID, so we're a little overwhelmed with that, and about 2/3 of my census are all COVID positive patients. And y'all will see me mostly at the beginning of the year. So far, I help out a lot with y'all's resident orientation, so you'll see my face on day 1. And I also will kind of help guide you guys through the internal medicine process and be your technical preceptor for your first about 10 weeks of residency. I also have residents who like to come do elective time with me to either get a rounding experience with the hospitalist team or family practice team, or to just get a lot of experience with order entry, which I do a lot of, and anticoagulation consults.
And what are you working on now?
So right now, I'm working on keeping up with the orders this morning. It is definitely a busy winter season for us. And I'm also working on a few warfarin consults. My student, who's on rotation with me, is also going through remdesivir patients.
and looking at our COVID anticoagulation protocol. here in the hospital and outside the hospital in every way. So I'm sorry that you can't be here today to see the hospital in person, because it truly is a great place to be and to work. So I hope that you feel like you got a little piece of Piedmont today. Thank you for your time.